Delhi Chief Minister Arvind Kejriwal, what we've heard is very significant. Ladies and gentlemen, we have never seen a situation of the kind that's just been announced. There will be a complete lockdown in the national capital. Remember, so far, people were being encouraged to work from home. Now it is virtually compulsory, because if you're out in the streets and you can't establish your bona fides as a person who's delivering an essential service, you will be sent back home. And in case you're hoarding masks or any ventilator or any medical equipment as well, that will invite stiff penalty. This is what we've seen before this being announced in Wuhan. We've seen this being announced in Spain, in Italy. Now it's been announced in the national capital as well. And it's not just Delhi. There are 75 districts all across the country where this measure has been announced. I'll take you through some of the prominent districts. What you're hearing from the Delhi Chief Minister is exactly or more or less the same that will play out in other places. So in Andhra Pradesh, in places like Vijayawada, in Vizag, in Chandigarh, in Chhattisgarh, in Raipur, all the districts of Delhi, in Gujarat, in places like Gandhinagar, Surat, Vadodara, Ahmedabad, in Haryana, in places like Panchkula, Panipat, Sonipat, Faridabad, in Himachal Pradesh, in Kangra, in Srinagar and in Jammu, in Bengaluru, in Mysuru, in Kalburgi, in Idiki, in Kannur, in Kasargod, in Kottayam, in Trivandrum, in Kerala, as also Thrissur, in Maharashtra, in Ahmednagar. I'm taking you through the list that I've just received of the 75 districts where there will be a complete lockdown. So Aurangabad, Mumbai, Nagpur, Mumbai Suburban, Pune, Ratnagiri, Raigad, Thane, Yavatmal, Khurda, all these places there will be a lockdown. In Punjab, in Hoshiarpur, in Bhilwara, in Rajasthan, Junjunu, Sikar, Jaipur, in Tamil Nadu, in Chennai, in Erode, in Kanchipuram. You can get more information on our website, indiatoday.com. I want to go across to one of India's best known surgeons, Dr. Naresh Trehan. In many ways, the face of the medical fraternity in India. He's joining us. What we've seen, Dr. Trehan, announced right now by the central government, and after that, the follow-up action by the Delhi Chief Minister is unprecedented. People who are watching will wonder, is this how bad the situation really is? Do we need to lock down 75 districts? As one of our most experienced and established medical practitioners, try and help us make sense of what we're seeing unfolding around us, sir.
So this is the most welcome news that I've heard today, because we've been saying since a few days, the medical community, that this action will have to be taken to actually break the chain that is developing, because now the numbers are going up exponentially, and we now know that this is community infection spread is happening. Now, if that is the case, we need to immediately try to interrupt this chain reaction, because it spreads from human being to human being. If we can disconnect the public from each other, break them up into their home modules, we have a chance that we can slow down the spread of infection, giving us a chance to actually prepare ourselves also for two things will happen. One, if we can slow it down, the curve will be more flat. We will not have a peak where we get thousands and thousands of people in one day. So maybe it will be a slow progression, and it will give us a chance to be able to treat people. India has such a large population. We may have 5-10 million people who may need an intensive care unit. We have less than 1 million intensive care units in the whole country. So the whole idea is that we try everything possible, because if the whole public participates, blocks itself into small groups like in a home, then there is every possibility that in the next 10-12 days we'll identify those people who have it. From their homes they should be able to report that yes, we have the symptoms. We actually treat them and put the isolation into the family, so that those little pockets which actually make up the big hole can be contained at that level. Now this is the exercise of a lockdown. And I'm so glad to hear that the Chief Minister of Delhi has announced this for Delhi for the next week, and if need be, it will be extended further. But I think that this is the best measure we can take at the public level. The government is, in the meantime, gets extra time to prepare. The government and the private healthcare providers will get extra time to prepare ourselves for the beds needed, for the equipment needed. So in all aspects, this is a good thing. Hopefully, it will control it to a great level. And we, as warriors of the public warriors, will absolutely have participated in the war against this invisible enemy. So now, what are the things that we expect?
Explain this to me once again. How difficult do you believe this will be to enforce? Today was a Sunday. Everyone was home. You know, one day if you're told don't go out, yes, it's bothersome, but you can still live with it. If you're told for 2 weeks don't go out, there could be chaos. I mean, for example, my wife's messaging me and saying, you know, you told me not to stock up, which is what the Prime Minister said, and everyone's saying don't panic. We don't have enough food till the 31st. How are we going to survive? So this, I'm sure, will be a recurring question. How do you enforce the practicality of a lockdown?
See, the practicality of a lockdown is that you can, as individuals, go and buy. If you are going to the shop to buy food stuff, you can go. But you don't go that the whole streets are full of people who have to go to work or coming back, or there are large markets open. See, those things have stopped. So you are saying home delivery is possible. If somebody has to go out and buy some essential supplies, like the Chief Minister explained, that will be allowed. But you try to refrain. The whole thing is, if you start stocking up for long term, in a home, you buy material for 4, 5, 6, 7 days anyway. Now that's the kind of supplies you need. There's no shortage of food, that the Prime Minister also said the other day. In India, there is no shortage of food. So we should not panic. We should, in a measured form, get prepared for a lockdown, which is a good thing, because if we do not do it, and the infection spreads the way it has spread in some of the other countries, there will be a huge price to pay. We will all suffer hugely. You cannot even imagine the magnitude of the problem that can occur in India. We are 1.5 billion people. We don't have
Explain
those
that to us. I want you, Dr. Trehan, to use all the wisdom that you have
so far
to try and extrapolate if what happened in Italy, if what happened in Spain were to happen in India, what is the potential of the problem that we're looking at? Because a lot of people will wonder, why do I need to cooperate? Explain that to our viewers. If we don't follow this lockdown as much as we possibly can, what could be the consequences we'll end up having to deal with? Dr. Trehan.
So you just have to look at the curves of spread of infection in other countries which are before us. So like somebody said, we have been lucky that it's coming late to India. We can study the experience of other countries. A country like Italy, which has, I think, around 60, 70 million people, has been devastated because they did not take action in time. Singapore and South Korea show us very quickly that they actually clamped down on it very early. They started testing very early. The people were very disciplined and participative. So the whole country fought the battle, and you know that the lowest death rate is in Singapore and South Korea. South Korea, I think, has 12 deaths, and Singapore has 0 or something. So you are saying that it is possible to fight it. It is possible to contain it. The people have to understand it. If people are careless, they will pay a big price. So if we, even now, if we discipline ourselves, we follow the lockdown meticulously, we will be the gainers. It's the people's war. It's not a war of the government. It's not like at the border that the army is fighting and you are sitting comfortably at home. You are going to be affected in your own home. Your families are going to be affected. What else can one say to drive it into somebody's head? That as a population, please wake up. We have gone, I mean, ad nauseum we've been saying it. Wake up, fight it, and come ahead. become a winner this time. Be careless and you suffer for it. In spite of being if careless, there may be some price to pay. But if you're not careful, we will have a major price to pay as people, as community, as country, because we do not have enough resources in this country to treat if thousands and thousands and thousands of people get sick.
Trehan, if you heard that press conference by the Health Ministry and the ICMR official today, they said we've bought 1,200 ventilators so far. They said we're looking at the situation carefully, our response is graded and calibrated, but the number there was 1,200. Do you think we have done enough? Because things are possibly going to get worse before they get better. Do you believe that the Indian medical system is geared to deal with the enormity of the challenge that faces us?
You know, if this spreads, the deadly virus that it is, if it spreads and it gets into that pandemic state in India also, we will need tens of thousands of ventilators. Because the main problem with this virus is that it affects the lungs and the intestines. Lungs, they block off the airway, the transfer of oxygen across the lung membrane. That damage prevents people from being able to breathe oxygen and oxygenate their body. Then they need ventilators. So if this happens, we will need many more ventilators than we have available in the country today. And also, to acquire them so rapidly will be a difficult task. So I think the money lies in prevention. If we can break the cycle, we can reduce the brunt of the disease, we shall be that much sort of happier and winning the battle, because we will be able to contain it. If we can't contain it, it will be a tragedy for everybody. So please, we have been saying it for 2-3 days, but today the situation is even becoming more and more grave, because the last 3 days have thrown up larger and larger numbers. There are 2 more deaths today. So the indicators are very clear. If we choose to ignore it, I mean, that's to me is a dumb thing to do, is a stupid thing to do.
Dr. Trehan is saying is important. Don't try and underplay the situation. Don't try and think that it's all kosher, because it's not. You have to realize the enormity of the challenge. Don't make it seem as if things are under control, because unless everybody comes together in a concerted action, there will be a problem. Now, train services, Dr. Trehan, have been shut down. Metro services have been shut down. So when people are watching, and there are many who want to go back home, is your advice that just stay where you are? Because there are many people, some of whom are daily wage workers, some of whom are no longer going to work, and therefore they'll wonder, can I find a way of going back to my town, my village, my city, so that I can be with my parents? My parents are old, they're aged, they're feeling insecure. Can I be with them? What's your advice? Because those are the kind of tricky situations people are having to deal with.
Yes, you're right. It is going to cause a lot of hardship. And it is true that this is where the government can come to help. So, on one hand, trains are all crowded, are actually the pulpit of spread of infection. So they had to be stopped. There will be problems, but it is a temporary inconvenience as compared to a long drawn loss to the country, to everybody. There will be loss of jobs, there will be economic crisis, there will be food crisis. So those things are horrific. But as compared to those, what we can go through today and find some genuine way of coping with it, and we must help each other in people coping. So I think that if we cooperate with each other, we cope together, we will be averting a bigger disaster. Now, God willing, nothing happens. That somehow the heat destroys the virus, or India is blessed in some way that other countries are not. Well, then we can celebrate. But I'm telling you that very clearly, if you see what's going on in the world, there is very little to tell us that if we don't behave ourselves, if we don't become concerned and serious about it, we shall suffer the same fate. In Italy, they had to call in the army to take away the dead bodies. That's how serious the situation is. Why? I mean, what does it take? I'll give you an example. People have come from overseas. Especially now, recently, people have come from England, where the disease is rampant and they haven't told anybody. Now, they are the ones who are spreading it. I don't know if you've heard of this story. A lady came to Chandigarh, got a massage. From London she came, didn't tell anybody, got a massage. The lady who gave the massage got the disease. Her whole community, her whole cluster of village has been locked down because that's how it just spread from a massage. So it is a very, very easily spreadable infection. Everybody said it's such a deadly virus, we haven't seen something like this before because it spreads so easily. So I think that, I mean, you can't belabor the point any further, but if every Indian takes it seriously, we will win this war. No question. As the Prime Minister said, he came on the TV and I said I would urge that he should come again and again and drive the point home to everybody, the seriousness and the hope that if we can fight it, we will be way ahead of the curve, but not
Dr.
suffer
Trehan,
the fate
the case
of China
of
or
Italy
Italy
and
or
Spain
Iran.
is illustrative. You mentioned Italy in your response. I want you to explain to our viewers, what did Italy do wrong? What are the lessons people watching at this time can learn from what all went wrong in Italy so as to ensure that we don't end up making the same mistakes? Because remember, Italy still has way better medical care facilities than India does. It's a far more developed country, and therefore if they're struggling in the way that we are, it's important to learn lessons from what went wrong in Italy. Dr. Trehan, can you please explain to our viewers what are the lessons from Italy?
So if you make a comparison of South Korea and Italy, which are two similar populations in a way, equally developed, South Korea jumped on testing and isolating people immediately when the breakout happened. Italy delayed the testing. Because of that, the spread was very rapid. People didn't know who has infection. They were socializing, they were cohorting. So all that spread so rapidly. So that is the whole difference. Segregating the population which is infected from the rest of the population is the safest. Singapore did the same. Spain, again, now is the latest victim. So there were in America, the same thing happened. There were not enough kits available immediately to do the testing. And it spread like wildfire in some pockets. So I think it is clear that genetically we are maybe different from other people and maybe the virus cannot attack us. I mean, that would be a miracle. But if you look at the way it's galloping right now in our country, you know we are equally vulnerable as the rest of the world, and testing and lockdown is the only thing you can do. There's no other choices. There is no medicine right now. There is no vaccine. So let's make that effort at least to try to protect ourselves and save the country from a brink if we can. Why not?
Second time you've said it, Dr. Trehan, and therefore I want to delve into this a little deeper. You've said twice over that there could be something different about India, the weather, the people, that maybe we won't get impacted as people in the northern hemisphere, in Europe. Is that something you actually believe? Because there have been so many stories that Indian immunity levels are higher, people eat off the roads, their immune systems aren't quite as vulnerable as people in Europe, and therefore we won't be impacted. Is there any medical rationale to that belief, or do you believe this is just like WhatsApp University in overdrive?
That would be the best news for all of us, especially the ones in the medical community, because we have been collectively worrying about what's going to go on and how out of control it can be. But by these measures or whatever luck, it doesn't matter why it did not happen. If we get a blunted infection, fantastic. We should be, I don't know, I don't know if you saw a picture of somebody put a mask on a Shiv Lingam and started praying there, ke, Shivji, please don't let the disease come here. Maybe there are unknown forces which we don't know about, but whatever it is, Right now, the way it's going, it is following the same pattern of the other countries that have been affected quite badly. So,
At this moment, Dr. RP Singh from the
willing, like I
BJP, I
said,
want to
if
welcome
something
Vivek
like that
Oberoi, but
happens,
before that,
so be
I have
it.
one more question to Dr. Naresh Trehan before I let him go. You know, one of the things that was said in the press conference was about testing. They've allowed private laboratories to charge up to 4,500 rupees and they will be allowed to test. The other thing that was said was about the number of tests in India vis-a-vis the number of tests internationally. What are you making, sir, of the number of tests that we are doing at this moment? The number that was given out by the Indian Council for Medical Research was 5,000 corona tests last week. So far, 15,000 cases. That's what came out of the press briefing. Is that testing enough, or does this need to be scaled up? What would be, at this moment, the optimal level of testing, Dr. Trehan?
So if you look at South Korea has done over 250,000 testing and their population is a fraction of ours. So I think there comes a different level of testing at different stages. So what the government was doing was actually validating, controlling the testing, rightfully so, because of the fact that you don't want willy-nilly everybody to rush to a place for getting tested and create panic. Now, because we have such a vast country, we have so many people, we need many, many more labs, and rightfully so. We did this at the time of swine flu. The government has done it again, fixed the price, fixed the criteria under which the test should be done, because unnecessary testing will not help and will only create more economic stress and chaos. So I think the government has taken the right steps. You can argue whether it could have been done a few days ago or today. Well, that's now the history. Let's move forward. If we can detect all the cases who are suspect. So what we are saying is, if you have a cough, cold, fever, please go to your doctor. The doctor is fully equipped to check your symptoms and prescribe that if you need a test. Please go get yourself tested if that be so. So I think that everybody should not run. They should go to their doctors if the symptoms that are described, and then be tested legitimately.
Okay.
I think this will help. This will help to tell people who are infected. They'll help them to take care of themselves and isolate themselves.
Very much, Dr. Trehan. We really appreciate you joining us and sharing your very lucid thoughts on where we are at. Vivek Oberoi joins us, RP Singh joins us. Vivek Oberoi, the government's really calling for a lot. This big lockdown, and while the Delhi Chief Minister did say that there'll be police out on the roads, they'll try and barricade, they'll try and check where you're going and how you're going. This will essentially come down to the Indian people as a community deciding whether they want to follow this or try. If you want to try and do some jugaad, try and find some sneaky way around it, there will be 100 such ways. And I think the point that Dr. Trehan makes is, this is not about the Indian army, this is about your own health. Therefore, if you violate it, you yourself are imperiling your own life.
Absolutely, Rahul. I couldn't agree with you more. I think today was a fantastic demonstration of what can be done and how we can contribute just by staying at home. You know, ये जो संकल्प लेने के लिए PM मोदी जी ने कहा भी हम सबको, and to keep the संयम. I think today was just probably one of the most historic days. I've never experienced anything like it. I could, you know, not just the locality, not just the city, but the whole country was reverberating in unity. You know, in gratitude to all the medical workers, nurses, essential services providers, and even people like you from the media who are doing their bit to constantly, you know, inform the people at large so that there's no panic, there's no wrong reaction. Because we've seen in the past that sometimes panic is what creates more damage than the disease in itself or the problem in itself. But it is time for us to let, you know, go of the jugaad mentality for a bit and, you know, really come out there and do this with sincerity. This self-isolation is really important. This social distancing is really important, because a country like ours, with the lack of facilities, and it was very informative talk by Dr. Naresh Trehan. I was hearing the whole conversation. You know, it could spread like wildfire and would be uncontainable. You know, I myself am mentoring a startup in Karnataka that has been working on ventilators to make them in India, to make them at a fraction of the cost. And in fact, we're trying now to reach out to the health ministry to expedite the process of approval, because we feel that this is the time when something like that would be an absolute essential life-saving equipment at a time like this. But while I was doing that process, I learned so much, Rahul, about the lack of it, the lack of ventilators, the lack of assisted breathing equipment in the country. And this is what we all know, that corona attacks and damages your ability to breathe first. I mean, it's the lungs that take the impact. So we are not in a situation like Europe. I think here it could escalate phenomenally, it could escalate exponentially, and we should be better safe than sorry.
Let me put that question to RP Singh from the Bharatiya Janata Party. Now, the problem with ventilators isn't being felt just at this moment because the number of cases of corona infections is low. But if this starts skyrocketing in the manner that it did in Italy or in Spain, how prepared do you believe, Dr. Singh, the Indian government is to be able to RP deal with the shortage of ventilators that Vivek Oberoi is pointing out?
See, Rahul, before I come to the ventilator issue, we should understand that this is a war against an enemy which we can't see, and all of us need to be like soldiers, and all of us need to be prepared for that. One. Secondly, I heard Dr. Trehan speaking just before me. One point which he said, that if you are not well, if you are having some nose flow or all, I will appreciate. Anyone who's having any such symptom should do self-isolation on his own and consult doctor and do self-isolation on his own. And if the symptoms go which are of coronavirus, should go for checkup, and then we should try to restrain that. We know our limitations, country's limitations. So we have to work within those limitations. It's not that we don't, all Indians know about the limitations of the health services we have. So you have to work within those limitations.
I'm going to take a very quick break right now, and I think RP Singh makes an important point, because if at this moment you start carping too much about the lack of ventilators, or we don't spend enough on medical and healthcare facilities, you're in the middle of a war. When you're in the middle of the war, as Ved Prakash Malik, the former Chief of the Army Staff, said, during the Kargil war, the Indian Army will fight with what it has. And that, I think, is crucial. This is the Indian people, the Indian government, the Indian nation fighting with the enemy, which is the coronavirus, with what you have. You have to maximize your chances of survival, ensure that you flatten as much as you can the spread of the disease, so that most of us come out of this alive and well. That is crucial. If you attack the government, attack that they don't have enough ventilators, etc. I mean, at a time when everybody's trying to buy ventilators, how many extra ventilators can we possibly buy at such short notice? We're slipping into a break. We're tracking all dimensions of this story like absolutely nobody else is. You've already sent us so many feedbacks of how, so many videos of how you got together at 5 p.m. to mark that moment that the Prime Minister said when India must come together to salute the corona warriors. We'll track every dimension of this story when I return on the other side of a quick break. You're watching India Today. Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.